Welcome to the online Heart Function Education class hosted by the Cardiac Sciences Heart Function Clinic. We are going to cover a few topics in this presentation, which is meant to be a general overview of heart failure and heart failure management. We will briefly talk about the Heart Function Clinic, which is located at St. Boniface Hospital. It's okay if you've never heard of this clinic or been there before, we will just briefly touch on it. We will discuss what heart failure is and what it feels like, and what symptoms to watch for. You will then hear from a physiotherapist about physical activity and exercise, a pharmacist about heart failure-related medications and treatments, and finally, a dietitian who will discuss a heart failure healthy diet and what to avoid or reduce. The Cardiac Sciences Heart Function Clinic, located on the second floor of the Bergen Center at St. Boniface Hospital, is a place you may be referred to where a specialty team can address your heart failure needs. These are the members of the Heart Function team. We are made up of 3 heart failure trained cardiologists, 2 nurse practitioners, 5 nurses, our clinic clerk, and the research team. Dr. Shelley Zeroth is our director, and therefore her name is listed on all appointment letters and tests. For those attending the Heart Function Clinic, an initial visit will look like this. You will meet with a nurse and a cardiologist, and sometimes with a pharmacist. We will review your medications, so we do ask that you bring your medications or an updated list to this visit. We will ask you questions and do a physical exam. We will establish a plan of care, which will include teaching strategies and any medication changes. Finally, we will discuss a follow-up plan for when we will book you back into the Heart Function Clinic. A follow-up visit will look like this. You will meet with a nurse or nurse practitioner and sometimes a cardiologist. We will review your medications, so again, we ask that you please bring your medications or an updated list with you. We will ask you questions and do a physical exam. We will establish a plan of care, which will include teaching strategies and any medication changes. Finally, we will discuss a follow-up plan for when we will book you back into the Heart Function Clinic. There is the possibility that you may qualify for graduation from the Heart Function Clinic back to the care of your primary care provider, which is your family doctor or nurse practitioner, for your heart function care. Those who qualify are those who have stable symptoms for 12 months or more on optimal medical therapy, have a primary care provider with experience in managing heart function, and have had no recent hospitalizations or ER visits for heart failure. It's important to remember a few things about our clinic. We have a shared practice, meaning not all appointments will be with the same cardiologist, nurse, or nurse practitioner. We do this to reduce wait times and to allow for better care. Most follow-up appointments will not be with a doctor, but rather will be with a nurse or nurse practitioner who's trained in managing heart function. Please remember to bring your medications or an updated list to every single visit. If you cannot attend your scheduled appointment for any reason, please call us to let us know as soon as you can. If you have a question or concern for the Heart Function team, do not wait for your next scheduled appointment to call and ask. Call us as soon as you have a question or concern to avoid getting more sick while you are waiting for your appointment. Our clinic is open Monday to Friday, 8 a.m. to 4 p.m. We are closed on weekends and statutory holidays. If you are calling the Heart Function Clinic team and don't reach us directly, please leave us a message. We will do our best to return your call within 2 business days. Please only leave a message for one member of the team to avoid multiple people trying to call you back at once. Heart Failure Support Group of Manitoba is available to you to join. You can get more information from the posted email or by joining the Facebook group. They are a community-run support group who are committed to creating a network of support for those living with heart failure. Heart Failure Awareness Day is an annual event hosted by the Heart Failure team and various speakers. It is typically held in May of every year at the Canadiens Transcona. The topics are changed every year based on feedback to remain informative to current needs. So let's move on to talk about heart failure. Heart failure is when your heart is not pumping as strongly as it should and your body does not get the right amount of blood, oxygen, and nutrients that it needs to work properly. The heart muscle can become weakened over time, and so it does not pump well. In some cases, the heart can also become stiffened. Here is a photo of a normal heart, which normally pumps blood in a smooth and synchronized way. Here is a photo of a heart with heart failure. You can see it has become enlarged and misshapen, which causes it not to be as able to pump blood out toward your body. One of the ways we diagnose heart failure is with something called the ejection fraction. The ejection fraction is the percentage of blood that is pumped out of your heart and toward your body with each heartbeat. A normal ejection fraction or percentage is around 60%. It is important to know, however, that heart failure does not necessarily mean that you have had or are having a heart attack or MI, though this is a common cause. Heart failure does not mean your heart will continue to fail, and it does not necessarily mean you will need a heart transplant to replace your weakened heart. Heart failure does not happen overnight. It is a condition that develops over time due to many causes. Some people have more than one cause. Heart attacks are a common cause. Some other causes include diabetes, viruses, cardiomyopathy, valve disease, chemotherapy, pregnancy, alcohol, drugs, and high blood pressure that is not treated. So what does heart failure look and feel like? Many people will experience at least some, if not all, of these symptoms. These symptoms are all related to the fact that the heart is not pumping effectively, and also because blood can back up and cause fluid retention and congestion. It is important to check in with yourself every day and recognize when you are having heart failure symptoms. This form is called the heart failure zones. In the top blue section is what we ask you to do every day to try and keep track of and control your heart failure symptoms. The green, yellow, and red zones will tell you if your symptoms are controlled or not and what to do about it. Every day, we ask you to keep the total fluid amount that you consume between 6 to 8 cups or 1.5 to 2 liters. A fluid counts as everything that is liquid at room temperature. We ask that you take your medications as prescribed by your care providers. We ask you to check your body for swelling in your feet, ankles, legs, and stomach. We ask you to eat foods that are low in salt or salt-free. And we ask you to balance activity and rest throughout your day. Another important thing we ask you to check daily is your weight. Step on a scale first thing in the morning after you wake up and go to the bathroom and before you eat or drink anything. Wear similar clothing each time and keep the number written in a journal. A weight gain of more than 4 pounds in 2 days or 5 pounds in 1 week can mean there is an overload of fluid. Some other signs of fluid overload include decreased exercise tolerance, increased shortness of breath, increasing need in the number of pillows underneath your head when you try to lay down, and swelling. You are in the green zone when you aren't showing signs of swelling in your feet, ankles, legs, or stomach. There's no increase in your weight by more than 4 pounds in 2 days or 5 pounds in a week. No increase in the number of pillows used when you lay down. No change in your exercise tolerance. Being in the green zone means your symptoms are under control. You are in the yellow zone when you notice new swelling or an increase in your previous amount of swelling, weight gain, adding extra pillows behind your head when you lay down, more shortness of breath, or a decrease in your exercise tolerance. When you find yourself in the yellow zone, please notify your primary care provider, which is either your family doctor or nurse practitioner. If you are a patient of the heart failure clinic, please call us to let us know of your symptoms. You are in the red zone if you are struggling to breathe, if your shortness of breath doesn't go away with rest, if you have a fast heartbeat that does not slow down when you rest, you have chest pain that does not go away with rest or with medicine, you are having trouble thinking clearly or are feeling confused, or if you have fainted. For any of these symptoms, please go to the nearest emergency department or call 911 or your local emergency number. Managing heart failure can be difficult, but it's important to take an active role in your health since there are many benefits including improving your symptoms, improving your quality of life, preventing hospital admissions, and prolonging your life. Now we are going to continue on with a presentation from the physiotherapist about physical activity and exercise.
Hi, I'm a physiotherapist at St. Boniface Hospital and would like to talk to you today about physical activity and heart failure. In today's presentation, I will cover the benefits of physical activity and review the guidelines, recommendations, and safety considerations of physical activity and heart failure. I will also provide examples and discuss some community resources so you can safely begin to implement physical activity into your daily routine. Please note, the information discussed in this presentation is general information. If you have a specific health concern or question, please speak to your healthcare provider before starting a physical activity program. Also, the terms physical activity and exercise will be used interchangeably throughout this presentation. Benefits of physical activity. Physical activity will not necessarily make your heart stronger, but it will increase muscle strength and endurance, decrease stress on your heart, make your heart more efficient, and help you do more in your daily life. Physical activity is medicine. Just like you take your medications as prescribed, regular physical activity is important. Now that we know physical activity is important, the next question is, how much physical activity is best? You don't want too much or too little, but just the right amount. Here are some guidelines and recommendations to outline what the right amount looks like. First, what type of physical activity is best? You can choose any activity that makes your heart beat a little faster and harder. It should be a planned and controlled activity and should involve large muscle groups like your arms and legs. It's also important to choose something you enjoy. Some examples of activities are shown here: golfing, riding a bike, dancing, using an exercise machine, walking, gardening, swimming, or participating in an exercise class. Remember, you want to choose an activity that is right for you. How long should you participate in physical activity? The goal should be 30 minutes total. This does not need to be done all at once, but can be broken up into a few shorter sessions throughout the day. For example, instead of going for a 30-minute walk, you could go for 3 10-minute walks or 6 5-minute walks throughout the day. Remember to start slow and build up your tolerance. Choose a length of time that you can handle. How often should you be physically active? 5 to 7 days per week is recommended. How hard should the physical activity be? It's about a balance. You don't want to be exhausted, but you also want to feel like you've done something. Here is a table to help you figure out the right balance. It's a 0 to 10 scale that helps you rate your perceived exertion or rate how hard the physical activity feels. In other words, what intensity are you working at? On the scale, 0 is the easiest. If your exertion is between a 3 to 5, it should feel moderate to somewhat hard or even hard. But you should still have enough breath to talk and carry on a conversation. If the activity starts to become very hard and you are gasping for breath, you are working too hard. On the other hand, if the activity feels easy and you have enough breath to sing, you are not working hard enough. Remember, it's all about a balance. Now, just because you want to stay between a 3 to 5 on the scale during physical activity does not mean you always have to stay between a 3 to 5 for all activities during the day. For example, if you are getting dressed in the morning or working in the kitchen, it's okay if you feel your effort is equal to a 1 or a 2 on the scale. As long as you never do anything during the day that feels more than a 5 out of 10 on the effort scale, you are doing okay. Safety considerations. As discussed previously by the nurse, if you are in the green heart failure zone, you are feeling well. So it makes sense that this is the only zone where you should be exercising. If you are in the yellow or the red zone, you should be contacting your doctor or seeking medical attention, not exercising. Stop exercising if you are lightheaded or dizzy, more tired than normal, or more short of breath than normal. Call 911 if you have pressure or pain in your chest, neck, jaw, or shoulders that does not go away with rest or medicine. If you have a fast heartbeat that does not slow down with rest. If you feel like throwing up, are nauseous or vomiting. If you feel your heart skipping beats and this is new for you, or if you have an implanted heart device and it gives you a shock. Remember, don't overdo it. It's important to exercise, but it's also important to balance activity with rest. During rest periods, the heart slows down and relaxes. Rest gives your heart a chance to catch up to the demands of the day. Here are some tips to help you conserve your energy throughout the day so you don't use up all the energy in your tank at one time. First, evaluate your day or week. What do you want to do the most? Make sure you save enough energy for these things. Get extra rest the day before a celebration so you feel fresh and can enjoy yourself. Break up daily routines with rest periods between activities. Divide long activities into shorter periods, like breaking up your shopping trip into several shorter, smaller trips. And sit to do activities that don't require standing. When you are resting throughout the day, you may choose to position yourself with your feet and legs raised. This helps blood return back to the heart and can decrease swelling in your lower limbs. Now, let's talk about some examples of physical activity. Please note, the following are general examples. If you have specific questions or concerns, please speak to a healthcare professional before starting an exercise program. It is a good idea to include a warm-up and cool down in your exercise session. Sometimes warming up and cooling down seems unnecessary, but it does provide significant benefits to your heart. A warm-up helps to prepare your muscles for an activity. A cool down lets your heart rate slowly return to its resting state. The warm-up and cool down should take about 5 minutes and can include walking, cycling, your chosen activity done at a slower pace, and stretching. Remember to keep the intensity at an easy level. On the 0 to 10 scale, your warm-up and cool down should be a 1 or 2. It should feel very easy or easy, and you should have enough breath to sing. Including stretches in your warm-up or cool down will help to improve your flexibility. Hold each stretch for 15 to 30 seconds. Avoid bouncing motions. You should feel a strong but comfortable pull. Start with large muscle groups like your calves, hamstrings, quadriceps, or chest. We are going to focus on 2 main types of physical activity. First, cardio training increases your heart rate and circulation. Examples are walking or riding a bike. Second, resistance training increases muscle strength and endurance and helps maintain bone strength. Examples are lifting weights. Here is an example of a cardio type workout for a beginner. Start by marching on the spot for 3 to 5 minutes while sitting in a chair. Stand up and walk for 3 to 5 minutes, taking standing or seated rest breaks as needed. Finish by marching on the spot for 3 to 5 minutes while sitting in a chair and doing a few stretches. If the beginner program is too easy, you can try something more advanced. Start with a 5-minute walk at a slow pace. Then walk a little faster for 5 to 10 minutes while keeping a steady pace. Finish by walking slowly again for 5 minutes and doing a few stretches. Let's break it down to a more specific walking program. Interspersing walks with rests is a good place to start. This is called interval training. In the top example, you could start with a slow walk up to 5 minutes in length. Then walk a bit faster for 3 minutes. Rest for 2 minutes. Walk for another 3 minutes. Rest for 2 minutes. And finally, slowly walk up to 5 minutes to cool down. Take as many rest breaks as you need. As your tolerance improves, interval training is easy to progress by either taking shorter or less frequent rest breaks. In the bottom table, you can see that there is only 1 rest break instead of 2 in the top example, and the rest break is now only 1 minute instead of 2. This is progress. Moving on to our second type of exercise, resistance training. For a beginner, range of motion exercises against gravity, which simply means moving your arms and legs in a natural motion, is a good place to start. Examples as shown in the pictures, could be straightening your leg or lifting your arm 5 to 10 times in a row. To make a resistance program more difficult, add light weights to the range of motion or increase the number of repetitions. Exercise tubing or bands, a can of soup, or a water bottle can be used to make it harder. Remember to stop if any exercise causes you pain. Never hold your breath while exercising, especially when lifting a weight. Instead, think about breathing in through your nose and out through your mouth. Continuing on, if you can already tolerate 30 minutes of continuous exercise, well done. You can now slowly progress your activity to 60 minutes as tolerated by adding increments of 2 to 3 minutes each week. You can increase the number of repetitions or add weight to your resistance exercises. But with any progressions, remember to still maintain a moderate intensity between 3 to 5 on the effort scale. If you choose to include both cardio and resistance in your exercise program, add it up. Aim for a total of 150 minutes of activity each week. For example, you may choose to do cardio 3 to 5 days of the week and alternate 2 days of resistance exercise with the cardio days. Additional tips. Climbing stairs may be part of your day-to-day activities, but it is not recommended to climb stairs as part of your exercise routine. Also, after having a flare-up or hospitalization, you should resume your activity gradually. Here are some community resources for physical activity. Cardiac rehabilitation is an excellent community resource. There are 2 locations in Winnipeg, the Refit Center on Taylor Avenue and the Wellness Institute on Leela Avenue. The program includes 16 weeks of supervised exercise programs as well as cardiac education classes. There is a cost to the program, but many private insurance plans provide coverage. No one is turned away for financial reasons. Subsidies are available based on income. Some rural options do exist. If you are interested, speak to your physician about a referral. Other community options include mall walking, community centers, walking tracks, and YMCAs. Check out the leisure guide for a variety of other activities available. Also check for the availability of fee waivers or financial assistance if cost is limiting you from participating. In summary, here are some tips and tricks to remember. Physical activity is important. Choose an activity you enjoy and stick to it. Start slow and gradually build up. Stop if you feel unwell. Work at a moderate intensity level and consider joining cardiac rehab.
Now we are going to continue on with a presentation from the pharmacist about medications related to heart failure.
We are going to go over the kinds of medications we use to treat heart failure. We will talk about the benefits of the medications as well as common side effects and things to watch for. There are many medications used to treat heart failure, but most can be grouped into 5 main classes. Those classes are ACE inhibitors, ARBs, or angiotensin receptor blockers, beta blockers, diuretics, and potassium-sparing diuretics. Over the following slides, I will explain more about what these types of drugs are and what they do for you. We will also touch on vaccines that are recommended for patients with heart failure. We will talk about over-the-counter medications and natural health products because some of these medications can have effects on heart failure. We will go over ways you can make it easier to remember and keep track of your medications. We are often asking you to take a lot of medications, and it can get quite complicated to manage. There are tools like bubble packs, dosettes, and pill alarms that can help. Lastly, we will talk about Pharmacare, which is a Manitoba program that can help with medication costs. Most people with heart failure require several medications for the best results. It is common for your doctor or nurse to increase the dose of these medications even if you feel better after starting them. That is because most heart failure medications work best at certain doses. Their purpose is not only to make you feel better in the short term, but also to treat the underlying disease and improve your health in the long run. Therefore, it is important to take all of your medications at the prescribed doses, even if you are feeling better. If you are taking all your medications and feel worse, be sure to tell your doctor or nurse. You may be feeling worse because of heart failure or another illness. You may also be experiencing side effects of your medications. All medications have side effects. The side effects can be mild and hardly noticeable, or they can be bothersome. If you think your medications are causing side effects, tell your doctor, nurse, or pharmacist about your symptoms. They will work with you to manage the symptoms and help you feel better. For example, some of your medications may decrease your blood pressure and make you feel dizzy. Staggering the time that you take some of your medications can decrease this problem. Medications are important in the treatment of heart failure. Research shows that heart failure medications can stabilize your heart function. They also can help you have fewer heart failure symptoms, which can help you breathe more easily, experience less swelling in your legs, increase your activity level, and have more energy. They help you stay out of hospital and slow the progression of heart failure to help you live longer. ACE inhibitors are a class of medications that include enalapril, lisinopril, perindopril, ramipril, and trandolapril. Basically, any medication that ends in pril is an ACE inhibitor. ACE inhibitors are helpful for people with heart failure. Research has shown that ACE inhibitors help people live longer and decrease hospitalizations. They also decrease symptoms of heart failure and increase your ability to be more active. They work by blocking the effects of harmful stress hormones, which are substances produced by your body that make heart failure worse. They also control high blood pressure and prevent heart attacks. However, ACE inhibitors are effective for heart failure even if you don't have high blood pressure. ACE inhibitors usually do not cause a lot of side effects in most people, but they can make some people feel dizzy. Let your doctor or nurse know if you feel dizzy after starting to take an ACE inhibitor. Starting with a low dose and increasing the amount slowly over time can reduce the chance this will happen. Because several heart failure medications can cause dizziness, spacing them out at different times throughout the day may help. If you feel dizzy when you wake up in the morning, try to dangle your legs on the side of the bed before sitting, then sit at the side of the bed for a minute before standing. Tell your doctor or nurse if you are dizzy for a long time after getting up, or so dizzy that you have trouble walking around or have fainted. ACE inhibitors can also cause a dry cough. You may have a cough for many other reasons. In fact, worsening heart failure can cause a cough. So do not assume that the cough is due to the ACE inhibitor. If you have a cough, talk to your doctor, nurse, or pharmacist about it. ACE inhibitors generally have a good effect on your kidneys long term. However, sometimes in the short term, they may cause kidney problems. They may also cause potassium levels to go up in your blood. These problems can be found with blood tests. Ask your doctor or nurse how often you should have your blood checked. ARBs, or angiotensin receptor blockers, are another class of medications that are useful to treat heart failure. They are generally used instead of ACE inhibitors for people who don't tolerate an ACE inhibitor. Some examples of ARBs include candesartan, irbesartan, losartan, valsartan, and telmisartan, basically any drug that ends in sartan. ARBs work similarly to ACE inhibitors and have similar benefits in terms of helping people live longer, stay out of hospitals, and decreasing symptoms. They have the same effects of blocking harmful stress hormones, controlling blood pressure, and helping to prevent heart attacks. ARBs also have similar side effects to ACE inhibitors. They can cause dizziness or low blood pressure, and they have the same sort of effect on the kidneys and on potassium. What is different about ARBs is that they do not cause a cough. So, for people who get a dry cough with an ACE inhibitor, it is often a good choice to switch to an ARB. The next class of drugs we use for heart failure is beta blockers. Examples of beta blockers include metoprolol, carvedilol, and bisoprolol, basically any drug ending in olol. Beta blockers help control high blood pressure, prevent heart attacks, and help regulate heart rhythm. They can keep your heart muscle strong. Beta blockers block the effects of harmful stress hormones that could otherwise make heart failure worse and contribute to symptoms. They are effective for heart failure even if you do not have high blood pressure or an irregular heartbeat. Beta blockers are very effective for people with heart failure. Research studies have shown that beta blockers improve heart function and can help people with heart failure feel better, live longer, and go to the hospital less often. Beta blockers can have some side effects. They can make you feel tired or dizzy. This can happen most often when you first start taking them or when your dose is increased. You will probably start on a low dose of beta blocker. The dose should be increased until you are taking the right dose for you. Sometimes it may take a while before people feel better after they start taking a beta blocker. You may even feel worse for a few weeks. Eventually, most people feel better than they were before they started taking the beta blocker. But if you feel dizzy, see your doctor or nurse. Many people with heart failure are on diuretics or water pills. The most common ones are furosemide or Lasix and metolazone. These are pills that make you pee more to help get rid of extra fluid in the body. Getting rid of extra fluid will help you breathe easier and prevent swelling in the legs or other areas of the body. Diuretics are helpful for improving the symptoms of heart failure. When peeing more, it is common to lose potassium in the urine. When taking diuretics, you will need to have blood tests done to watch for low potassium and ensure your kidneys are doing okay. Often, potassium supplements are necessary to keep potassium levels in the normal range. Diuretics can also cause dizziness by lowering your blood pressure. If you feel dizzy, speak to your nurse or doctor. One common problem people have with water pills is having to wake up at night to go to the bathroom. Try keeping the doses earlier in the day to help reduce the number of nighttime trips to the bathroom. If you take water pills once a day, be sure to take them in the morning. If you take them twice a day, take your second dose no later than 4 p.m. Another kind of water pill you may take is one called a potassium-sparing diuretic. Examples of this medication are spironolactone and eplerenone. These are water pills which, like their name suggests, help your body hold on to potassium. This means you will need to take less potassium supplements. Aside from their effects as a water pill, they also help by blocking the effects of harmful stress hormones. Studies have shown patients on spironolactone live longer and go to hospital less often. But this drug was studied in patients with advanced heart failure, so it's not for everyone. Over the last few slides, I've talked about potassium a lot. Potassium is an electrolyte that your body needs to function properly, especially your heart. It is found in many foods. As we've talked about, potassium levels can be affected by many medications used to treat heart failure, like diuretics, ACE inhibitors, and ARBs. For this reason, checking potassium levels is very important and part of the blood work you will have done on a regular basis. So, now that we've covered the common medications used for heart failure, we're going to move on to vaccinations. Vaccinations are important because people with heart failure are at higher risk of complications from infections. The 2 vaccines we recommend for everyone with heart failure are the flu shot for influenza and the pneumococcal vaccine, which is also called Pneumovax. The flu shot is needed every year because the kinds of flu that go around change every year. The pneumococcal vaccine is generally needed just once, although some people do require a second booster. Both of these medications are covered by the province of Manitoba, so you can get them at no cost. Despite what you may have heard, it is not possible to get the flu from the flu shot. Next, I want to touch on over-the-counter medications. Many of us select over-the-counter products when we have a cold, a headache, or an upset stomach. Some of these products can interfere with your heart failure medications, so it's always a good idea to talk to the pharmacist before selecting something. Some particular products to watch out for are medications called NSAIDs, which stand for non-steroidal anti-inflammatory drugs. Some NSAIDs are available by prescription only, and others are over-the-counter. Over-the-counter NSAIDs include naproxen, also called Aleve, and ibuprofen, called Advil or Motrin. Some common prescription NSAIDs are celecoxib, diclofenac, indomethacin, and ketorolac. These NSAIDs can all worsen heart failure and should be avoided. ASA or aspirin is also an NSAID, but the low doses of 81 milligrams a day or 325 milligrams a day are safe to take. If you need to choose something for pain, the safest option is acetaminophen, also called Tylenol. Regular or extra strength Tylenol is a great choice. NSAIDs can also hide in cough and cold products or muscle relaxants. Read your labels and ask the pharmacist if you are unsure. Many people are turning to natural health products to treat their various medical conditions. This includes vitamins, herbal remedies, homeopathic remedies, traditional medicines, probiotics, and other supplements. People often feel that these products are safer because they are natural. Unfortunately, these products are not always safe and can sometimes interfere with either heart failure or the prescription medications you are taking. It's important to tell your healthcare provider all the medications you are taking, including herbal products, so that we can ensure there are no problems. When researching these products, always consider the source of the information. While prescription and over-the-counter medications have to provide proof they work before they're allowed on the market, this is not always true of natural health products. If you are in doubt, talk to your pharmacist. Remember, natural does not mean safe. For a moment, think about how many medications you are on. 0 to 5, 5 to 10, 10 to 15. It must be difficult to remember to take all of those medications regularly. Maybe once a day. Morning pills aren't so bad. Take with breakfast and you're done for the day. But sometimes those pills are twice a day, like metoprolol, and it's easy to forget that second dose, especially if you're out for the day or on a trip. There are tools to help you remember. The top picture and the picture on the right show different kinds of dosettes or pill boxes. Many of you may use these already, but if you don't, I would strongly encourage you to try one. You can organize your pills for the week in them. The one on the right is especially good because you can remove the entire day's pills if you're going out. The picture on the bottom left shows a bubble pack. This is something the pharmacy makes up for you, where all your pills come pre-sorted when you pick them up from the pharmacy. There are different styles of these too, but this is a pretty common example of what they look like. One of the benefits of dose sets and bubble packs is that you can easily see if you've already taken your pills that day. When you use bottles, it can sometimes be hard to remember if you've taken that day's pills or not. With these tools, it's much easier to tell. Some other tips for remembering your pills are to set watch alarms or phone alarms that go off when it's time to take them. If you have a smartphone, you can use that for reminders. It can help to associate your pills with something else you do regularly, like keeping them visible in the kitchen and taking them with meals, or taking them twice a day when you brush your teeth. If you need to have doses with you when you aren't at home, certain pill boxes or dosettes can make it easier to take medications with you so you can take them on time. When traveling, it's a good idea to take more medication with you than you need, so that you don't run out if plans change. Pack your medications in your carry-on in case luggage gets lost. It is important not to run out of your medications. Reorder ahead of time so you never run out. If your prescription will run out before you can see your prescriber, call your prescriber's office, as prescriptions can be faxed directly to your pharmacy to ensure you don't go without medications. It's very important to keep a list of all the medications you're on and to keep it with you in your wallet. Make copies of it. Bring this list to your doctor or to clinics. This is an example of a medication list. It is also helpful to know how long you've been on the medication and any changes in your dose and when. Here is another example of a medication list. These are available at the Heart Failure Clinic and many other places. It gives you a nice format to fill in your own medications. The last thing I will talk about today is the Pharmacare Program. Pharmacare is a Manitoba program for all Manitoba residents to help with medication costs. If you pay for your medications and are not already enrolled in Pharmacare, I strongly advise you to do so. There is a one-page application that can be printed off from Pharmacare's website. When completing the form, you may select the one-time enrollment option, which gives Pharmacare permission to access your recent tax return information in order to assign you a Pharmacare deductible. They will do this automatically every year. Deductibles are the amount of money you will need to pay towards your medications each year. Pharmacare will pay the rest. Deductibles are calculated based on your total family income. The Pharmacare program runs from April 1st to March 31st. Beginning April 1st, if you are enrolled in Pharmacare, all your eligible prescription costs go towards your deductible automatically when you fill prescriptions. Once you have met your deductible, Pharmacare covers all further costs associated with eligible medications until March 31st of the following year. This will happen automatically when you fill your prescriptions anywhere in Manitoba. If your medication costs are high relative to your income, you may also qualify for the deductible installment plan. This allows you to pay your deductible in monthly installments over the year rather than pay it all at once. If you have any questions about how this works, talk to your pharmacist.
Now we are going to continue on with a presentation from the dietitian about a heart failure diet.
It's important to follow a prescribed diet when you have heart failure because it can help to decrease swelling, reduce the workload on the heart, and improve breathing. Diet to help manage heart failure includes general fluid allowance of 1,500 milliliters up to no more than 2,000 milliliters per day, and also a sodium allowance of no more than 2,000 milligrams of sodium per day. Let's first talk about fluid. A fluid is anything that is liquid at room temperature. Generally, people remember to count their water, coffee, tea, juice, and milk. But we cannot forget about items like broth and soup, gravies, ice cream, jellos, and ice cubes. We also cannot forget to include any alcoholic beverages. It can sometimes be difficult to track how much fluid is in a beverage. This image gives an idea on how much fluid is in a standard coffee cup you may get from a fast food chain. You can see that the small cup is 286 milliliters, and an extra large goes all the way up to 678 milliliters. When you think about needing to consume less than 2,000 milliliters, these drinks can often add up. Sometimes restricting fluids can lead to feeling thirsty or having a dry mouth. Some tips to manage thirst include spreading out your fluids throughout your entire day and making sure there's enough fluid in your allowance left over to last you until bedtime. Suck on sugar-free candies or gum. Run a humidifier to help the air feel less dry. Rinse your mouth with water and spit it out instead of swallowing or chew ice cubes. Eat moist or juicy foods. Keep in mind that salty foods will increase the urge to drink, so avoiding these foods will help with feeling of thirst. Now let's talk about sodium, which is salt. We ask that you consume no more than 2,000 milligrams of sodium in your food every day. To give you an idea, this is less than a teaspoon of salt. This sodium allowance includes all salt added to your food in the cooking process and at the table, as well as the salt that already exists in your food. Try to remember to aim for no more than 500 milligrams of sodium in each of your 3 daily meals and another 500 milligrams total for all of your snacks. This image shows where most of the sodium in our diets come from. As you can see, 77% of sodium comes in already made, processed, and prepackaged foods, as well as restaurant and fast foods. So while most people know that fast foods and restaurant foods have a lot of salt, it's important to remember that salt is used as a preservative in many processed foods like deli meats and prepackaged foods like deli meals and non-perishable items. About 12% of the sodium we consume is added during the cooking process, such as to flavor food or added to boiling water for cooking, as well as added salt to the prepared meal when it's on the plate. The last 11% of salt occurs naturally in the foods we eat. This image gives you an idea of how much salt is in each of these items. You can see that something like a Tim Hortons blueberry muffin has about 430 milligrams of sodium. A small piece of Delissio pizza has 750 milligrams of sodium. You can see that one pickle has almost 500 milligrams of sodium. When making a box of Kraft Dinner, only eating 3/4 of a cup gives you 330 milligrams of sodium. During cooking, ketchup and soy sauce are 2 commonly used sauces, and even though only using small amounts, they have quite a bit of sodium. This can add up throughout the day and over a week. Finally, at the bottom, you can see these prepackaged foods like Mr. Noodles and a frozen dinner have well over 1,000 milligrams of sodium. Here are 3 important steps to shake your salt habit. Do not add salt to your cooking or to your plate. Choose foods that are low in sodium, and learn to read food labels. Here are some of the ways you can avoid adding sodium. Get rid of your salt shaker. Don't add salt to your cooking or at the table. Experiment with salt-free herbs, spices, and seasoning mixes. When choosing foods that are low in sodium, try to pick fresh foods when you can. That includes fresh or frozen vegetables and fruit. Choose fresh meat, poultry, and fish. Prepare your food at home and from scratch as much as possible. That way you will know exactly how much salt goes into the entire meal. Avoid canned and processed foods as much as possible. If you have to choose a canned product, try to find the kinds that are packed in water instead of brine, and try to rinse the product really well with water before using to try to eliminate some of the salt. There are some foods that are very high in sodium, such as canned or dehydrated soups, snack foods such as chips, pretzels, crackers, and salted nuts, processed meats such as smokies, meats, bacon, hot dogs, and sausages, restaurant meals and frozen meals, condiments such as ketchup, soy sauce, teriyaki sauce, cooking wine, and flavored vinegars, any pickled foods such as pickles, olives, and sauerkraut, prepackaged pasta, rice, or potato meals such as sidekicks, vegetable juices such as tomato or carrot juice, processed cheeses, cheese spreads, and sauces, seasoning salts like garlic salt and onion salt. Limit your processed foods. These are generally items that last on the shelf for a very long time. There are many types of salt out there. As mentioned before, any product that is seasoning salt such as garlic salt, onion salt, or celery salt is still very salty. Some other products like lemon pepper seasoning don't have salt in the title, but is in the ingredient list. Products like sea salt are still salty and still cause trouble in those with heart failure. Some items are labeled half salt or no salt, and you should consult with your care providers if this is okay for you, since these products are flavored with potassium, which can become imbalanced. So you might be wondering at this point, what can you eat? Try to choose fresh or frozen fruits and vegetables. Choose lower fat milk, yogurt, and hard cheese instead of soft cheeses. Aim for whole grain breads and rolls, homemade lower fat muffins, hot and cold cereals, plain pasta and rice. Choose fresh meat, poultry, fish, legumes, and tuna or salmon packed in water. For seasoning, avoid salt seasonings and try products like Mrs. Dash and McCormick no added salt blends. There are also Epicure products that are salt-free. Use fresh or dried herbs and spices to flavor your food to your taste. Learning to read food labels can be difficult at first, but it can help you identify which foods are low in sodium, which are high in sodium, and should be avoided. You can start by checking the ingredient list for words like salt, sodium, and soda. Then look at the nutrition facts panel and see how much sodium is in the serving of the food. You can also use nutrition claims on the label such as no added salt. When looking at the nutrition facts claim that a label might have, it's important to know the difference in sodium even though they all claim to be low in sodium. A product that is considered sodium-free has less than 5 milligrams of sodium per serving. A product that is low in sodium has less than 140 milligrams of sodium per serving. A product that is considered reduced sodium has reduced their sodium content by 25%. You can see that even though the label may claim to be low in sodium or even sodium-free, the product still has sodium. Here's an example of the food label on a can of soup. This soup lists that it has 850 milligrams of sodium in a serving size. You can see at the top of the label that a serving size is 1 cup of the soup. When you picture a cup or 250 milliliters of soup, that's not very much food, and it's unlikely to fill you up for one entire meal. You might eat more than 1 cup, and you'd have to consider how much sodium you'd be eating in that case. Here's a different soup, which claims on its label it has 50% less sodium than their previous soup. You can see that it has 360 milligrams of sodium per serving, which is half a cup of soup. So it's a bit better of an option than the previous soup, but still has quite a bit of sodium per serving size, considering you're only allowed 2,000 milligrams per day. Here is another soup that claims to have no added sodium. You can see that it only has 40 milligrams of sodium per serving size, which is again half a cup, making this a healthy soup option. If you remember your guide of 500 milligrams of sodium per meal, this soup would allow you room to have 2 to 3 cups of soup or 1 cup of soup plus another low sodium food item for that meal. Restaurant foods typically have a high salt content, but it is possible to make healthy choices when eating out. Look at the menu on the internet beforehand, as there may be some nutritional information online. Request salad dressings, sauces, gravies, butters, and mayonnaise on the side. That way you only use what you absolutely need. Request your food to be prepared in a healthier way. Choose baked, roasted, grilled, broiled, and steamed more often. Avoid breaded and fried as much as you can. Substitute the fries option for a plain baked potato or ask for a double vegetable portion instead. Try to avoid salt soups and avoid adding salt or ordering foods that are high in MSG. Portion size is also important, so try to share a regular entree between 2 people or choose a small serving option when available. Plan to take any leftovers home with you to enjoy another day. Healthy eating is balanced, includes all 4 food groups, and helps our hearts while helping us to reach a healthier weight. So to recap, someone with heart failure should consume no more than 2,000 milligrams of sodium in a day and no more than 2,000 milliliters of fluid in a day. It is important to recognize that nutrition is important to someone living with heart failure. Understanding and remembering your sodium and fluid allowance is important in everyday life, and it is important to read labels, choose low sodium options, and eat out wisely. It is also important to monitor your weight daily for any changes.